lesson of today is work for an organization that can give you a title that's really awesome. Because my title, because I work for the government, is manager. How boring. But you can, if you want to, maybe we should all, refashion ourselves as champion of, right? And I'm very interested in hearing from all of you. And what is Sara? She is a champion of, and you can complete the sentence, right? And I'd love to hear about that after you learn a little bit about what it is that I do and what I feel passionate about in Fresno. The second lesson of the day is wear pants when you're going to be speaking in microphones. Very important lesson. It is. Okay, so the slides I was going to use are not here. Yeah. That's okay. I'm just going to speak. How's that? And maybe that was fortuitous, because I find myself in recent times being accused of being a Pollyanna. And the slides were all very compelling and interesting, and they talk about the blight of public health and the health of our community. And I think it's important that we're informed and we understand what that is. That we know that health is more than biology, it's more than genetics, it's far more than individual behavior, which often gets blamed. It's also socioeconomic status. Where you live makes a big difference. Do you own a car? Does your grocery store carry fruits and vegetables? Or is it covered with advertising for tobacco, alcohol, and sugar-sweetened beverages? What are your kids influenced by? What are your neighborhoods influenced by? It's a much bigger determinant of health than your individual decisions. Because when we look at what influences kids to smoke, what's the first thing that comes to mind? Peers. That's wrong. The biggest influence, based on research, is marketing. Really? It is marketing. Billions and billions of dollars in marketing. And it's disproportionate. You go to a neighborhood on the north end of our county, and we don't put up with windows covered with advertisements for tobacco, alcohol, and sugary beverages. But when you go to the southern part of the county, those kids are bombarded with messages from the time they are brand new. And there are preschoolers who can describe the specific ads and what colors they have and which cartoon they like the best in that commercial. They're on the floor, they're below 3 feet, they are targeting kids so they can get kids early. And that is true for most of our unhealthy products. And so there is an environmental factor to the behavior that we have that lands squarely in our health, that we can't ignore, but we can change. So it took us decades to get to this place, to get to a place where we have lots of stores that carry products that offer nothing to our bodies but convenience, maybe fill our stomachs a little bit, maybe numb the pain a little bit, but they don't actually offer us anything that's a contribution. And we're flooded with those. We have 5 times more fast food restaurants than grocery stores in the county of Fresno. And it's overwhelming. It's completely demoralizing if that's all you focus on. But I'm feeling a shift in the atmosphere. And I don't know if you're experiencing this around kids, but I am experiencing this in health. That people who have been involved in this work for a long time are suddenly, even though they've been working on the same thing for 10 years, they're hopeful again that it might work this time. Right? Even though it's the same thing, there's something that has shifted. And we're realizing successes in ways that are really cool. Recently, we worked in the city of Selma. We put it on our work plan for our tobacco prevention program. It's one of the programs in my office. And we went to Selma, and we have our evidence-based plan how to educate and inform, not lobby, to help them understand the benefits of less advertising at convenience stores. And safety folks are on board because they want to be able to see inside the stores. And we go to city councils, and where people have been very resistant in the past, we couldn't even do all of our objectives on the scope of work before they had passed an ordinance. Because it shifted. We are now chasing a ball that is rolling instead of pushing from behind with all our might. And that's what I want you to hear and know about the partnerships that you have in the room, about the partnerships that we're developing in health, is be careful, because Pollyanna's contagious, right? And you don't know which of the people at your table is Pollyanna yet, but you will catch the bug. And when you do, it's exhausting chasing that ball. And it's so wonderful, and it's so rewarding to see changes in our community that are truly systems change and policy change that is going to influence not just the people right now, but the people that come. And what's also cool is those same people who saw those changes are now understanding the empowerment they have and the voice that they have to say, well, if this can change, this can change, this can change. And pretty soon, we have not only reversed what has happened over the last few decades in health, in education, in poverty, but we can actually realize improvements. The consumption of soda, the obesity rates, they've all plateaued, and now they're starting to come down. So it's taken a long time, but the atmosphere has shifted. So spend more time in the room, talk to more people, figure out who has that Pollyanna bug, and you'll get caught. Thank you.